Hey guys, Doc Davidson here. We're back talking about the low back, okay? A lot of people keep smoking their back in the gym, which is fine if you're going for big reps. That's totally cool, right? And even when, maybe we're not doing a lift and maybe we're reaching down to tie our shoes or something like that, acute kind of, whoa, spasmy, stabbing in the back, right? A lot of the times, right, this can happen just due to a minor aggravation of the disc, right? If we had hurt our back before, right, studies are showing that as soon as you injure that disc, right, because it naturally wants to heal, right, blood vessels and nerves to control those blood vessels grow into the disc that weren't there before when we were, younger. So it's easier to aggravate our back. So how do we kind of tune that nervous system down, right? So we'll be talking about McKenzie extensions to kind of reduce that. So what we're going to do is there's two ways to do this, right? You can do it sitting or laying down or standing up. Okay, we're going to talk about both. We're going to first start on the ground because this is the one that's more than likely going to get you the most bang for your buck, but we'll teach you the standing one as well because you might not be able to lay down anywhere, okay? So, down on the ground, what I'm going to do is I'm totally relaxed and I want my hands right under my shoulders, okay? I don't want my elbows flaring out or anything like that. Nice and relaxed in this almost push-up position, okay? The next thing that I'm thinking about is I'm taking my pelvis, my pubic bone, and I'm pushing that down into the ground, right? Almost like I'm squeezing my butt. We want to imagine that got screwed into the ground, right? And it ain't going nowhere. So that's the setup. The motion is going to be this. Using primarily my arms, I am going to push up as soon as I feel a change in sensation. Whether that's pinching, pulling, tightness, whatever, right? As soon as I feel a change in sensation in the area of my low back that I was having the issues with, I'm gonna come straight down. We're not judging, right? If it's this far, that's as far as you need to go, right? What we're trying to do is we're trying to get that nervous system to just chill out, right? We want that nervous system to not associate motion with pain, okay? So we're on the ground, right? I'm pressing up. As soon as I feel it, I come back down. Pressing up, as soon as I feel it, come back down, right? As time goes on, right, as we get into those reps, you might find that you can go farther and farther back. Totally fine. We just never want to go into pain. Again, not to associate motion with pain. And two, right, we want to stay nice and passive at this beginning point, using primarily our arms, okay? But once we kind of get through that and we're finding that we can come all the way up and we're hitting really good range of motion in our back, right? Then we can start to use a little more active work with our low back to kind of re-engage some of those muscles and get things turned back on, okay? So if I'm here, what I can do, still the same passive push up, but what I'm gonna do from here is I'm gonna turn my back on. I'm gonna not contract my back so much that I have a spasm or anything like that, but I want to get a little bit of contraction and slowly lower myself down, almost imagining like a negative curl, right? At the gym when guys help each other lift the weight up and you're trying to fight it on the way down, that's exactly what we're doing with our back, okay? So I use my big strong arms, push myself up, and then I use my back to try to slow myself down. We push up, slow yourself down, right? That eccentric motor control will really start to get that back to activate and create a little more stability, right? As we start to work on the other things, turning on our core, mobilizing our hips to really help relieve that low back pain, okay? But that's the laying down version. You might not be able to do that everywhere, right? We may be at a gas station, we may be in the supermarket, right? So how do we do it without looking like a weirdo, right? So standing version, okay, what we're gonna do, feet are pointing nice and straight forward, right? That puts our hips into a really good position, right? If I'm totally externally rotated, right, I can create no torque in my hips, and so that pelvis can kind of rock around. If I'm turned all the way in, right, I'm hitting some impingement in the front, so nice and neutral forward, may have about 5 degrees out. That's neither here nor there, but I want to aim for straight forward. I can imagine getting a little bit of that torque into the ground to, again, keep that pelvis nice and righted. I'm going to take my hands and I'm gonna find my tailbone, right? From here, I'm not pressing into it by any means, but I do want to let my brain know, hey, this is my tailbone. I don't want this to move, okay? And from here, what I'm gonna do, exactly like the same when we were face down doing that kind of pushing maneuver, I'm gonna lean back, and as soon as I feel that change in sensation, I'm gonna come right back to neutral. Again, if it's super small, so be it, right? If it's pretty far, right, that's okay, right? I wanna keep my core tight, knowing that if I let everything loose and fall, I can get too much extension too quickly, and you get that pain response, which again, it's just like getting into a super hot tub, right? If you just jump in, that instantaneous surge of stimulus is gonna be too much, right? Versus slowly tiptoeing your way in, you'll be able to withstand much greater stimulus, right? So again, we're nice and slow for both of these, right? We wanna do about 10 of them for each set, right? Now, the things that we're watching for, a lot of this time, right, McKenzie extensions were designed for people with radiculopathy, sciatica, pain shooting from kind of the low back glute down into the leg, right? So if we're doing these motions and that pain is starting to reduce, fantastic, right? If that pain isn't really changing, that's okay, right? I'd love for it to be changing, but it's not a big deal. If it is ever getting worse, let's say I pump out 10 reps of these guys at the gas station while pumping up, and I can feel a little bit more, whether that's numbness or tingling, or a little burning, or a little electricity down into my glutes, my legs, anywhere like that, probably not a good idea, right? Back that off, right? At that point, you should be working with somebody to kind of triage you, right? To figure out, you know, is this a muscular referral pattern? Is this actually coming from a different source, right? Working with a professional like that is gonna be absolutely key if you're experiencing those kind of things. But for the 85% of the people that aren't having those issues, right? Trying about 10 reps per set. And honestly, I'd go about 5 or 6 sets a day, right? Again, it doesn't take that long, right? If I'm taking about a second to get there, second to get back, nice and leisurely, that's about what? 10 seconds, or no, let's call it 20 seconds times 6. That's like 2 or 3 minutes a day, right? So go ahead and play around with that one and see how your back's starting to feel, okay?